Hi, everybody. Welcome to the Chats with Chaudhry. I hope you're safe and well. Today, I'm delighted to be joined by PQE's Davide Buratti, who is GXP Compliance Operations Director. And today, not surprisingly, given his job title, we're going to be talking about GMP inspections. So, Davide, buongiorno. How are you, my friend?
Good morning. I'm good. Thank you. What about you?
I'm very well. It's lovely to meet you, Davide. Now, before we start talking about GMP inspections, could you first of all give me a quick overview of PQE? Not sure everybody knows who PQE are, and also a little bit about your own background. What's your role at PQE?
Okay, thank you for giving me the chance to be here today. So just a few words about PQE. PQE is a consulting company in the healthcare space. It is an Italian-based company, but we have now more than 22 subsidiaries all over the world and more than 30 offices spread around the world. So it's really a global company. My specific role, so I am responsible for all GXP services, consulting services in PQE, so including preclinical, clinical, regulatory affairs, GMP, pharmacovigilance, and third-party auditing.
Fantastic. Right, so let's talk about GMP authority inspections during the pandemic. It was obviously that became quite important, but obviously we had the whole issues about remote working as well. So what happened to GMP authority inspections during the pandemic?
Well, the COVID-19 pandemic has dramatically affected the landscape of GMP authority inspections worldwide. So as such, due to obvious global travel and safety restrictions during this period, the main business continuity tool to continue to perform inspections was the remote scenario, or also called distance assessment. So the remote inspections have been useful to enable the regulatory authorities to ensure continuity of compliance oversight during the pandemic, even if they cannot fully replace on-site inspections. So a review of inspection practices during the pandemic was carried out by a working group of the International Coalition of Medicines Regulatory Authorities, which is the ICMRA, which includes all the most important health authorities. And basically, what happened during the pandemic was that inspectors assessed the need for inspections on a case-by-case basis, applying quality risk management principles in their decisions. If this risk assessment determined that a remote evaluation was not suitable for regulatory compliance activities, inspections were either postponed to a better time or an hybrid approach was adopted. During this pandemic period, new technologies have been introduced to be able to reduce distances when executing these remote inspections. So, for instance, digital technologies were mostly used, such as video conferencing platforms like Teams or Zooms, and additional devices like smart glasses, in combination with an increased quality of the remote connection. It has to be said that an important challenge was also the IT capabilities of the inspected sites to support these enhanced communications. For instance, there are multiple factors that were considered during these remote inspections. So like the cellular signal coverage, the Wi-Fi coverage, the device battery life when performing these virtual tours, the camera image quality, and the stabilization. I would like now to mention some general challenges during these remote inspection period over the pandemic. So some facilities were found to be inadequate to support these complete virtual tours due to some interference with the Wi-Fi and with mobile phone signals. For instance, there are some areas or rooms that cannot support these virtual facility tours, like instrument rooms, utility areas, or explosion-proof rooms. In addition, there are some other aspects of an inspection that could not be performed with the same rigor as if an inspector was on site. So, for instance, when you're doing virtual facility tours, the inspectors had a limited field of view, position, resolution, and focus of cameras. Also, there is some kind of inability for an inspector to walk up to and to point at equipment during virtual tours.
Sure.
And also, conducting interviews during remote inspection is not as effective as being on site, as the inspectors are not fully capable to assess body language and identify evasive or nervous behaviors.
Right.
There are also other limitations or challenges that must be considered. For instance, if a company has a huge paper-based source ecosystems, well, this is not really adequate to support remote inspections. Another aspect when performing virtual facility tours is that for an inspector, it is difficult to get the holistic picture, and so to have an overall understanding and awareness of the site design philosophy and features. And finally, there are some additional considerations. For instance, during virtual facility tours or during remote inspections, there are some additional senses that cannot be replicated, like smell and sound. For instance, when an inspector is hearing alarms due to machinery or equipment or facility failures.
I mean, one question I've got to ask you with relation to that then is, and you talked about the challenges, where there were inspections where they had those failures due to Wi-Fi connection or access, what did inspectors do then? Did they sort of just rebook that, or did they have to try and arrange a different type of inspection for that facility?
Yeah, that's a good point. In those scenarios, of course, meetings and tours had to be rescheduled. And this is really pinpointing this fact. So remote inspections takes place over a much longer period than compared to on-site inspections due to these factors. So you mentioned the technical issues during the connections. Another aspect that can prolong the duration of remote inspections is the difference in time zones. So that can be significant on some occasions.
Sure.
Another aspect is that there is more time associated with documentation review due to the turnaround time of requests. And also translation requests that may not be performed spontaneously or in a timely manner.
Right. And you said, obviously, this was global in terms of looking at what happened during the pandemic. Did you find, though, that there was a big difference between regions? Because obviously, if you look at some parts of the world, you can say interconnectivity is much better than other parts of the world necessarily. So does that mean that the quality of inspection was not so good in some parts of the world compared to others?
I think that the authorities did a good job anyway, even considering these challenges. Generally speaking, well, technical, I would say that the technical issues are not linked to geography, but more to the capability and readiness of the inspected site to host this kind of inspection. So I would say that it's more a matter of be prepared and be ready for this new way of performing inspections. I would say that if we can recall what EMA, so the European Medicine Agency did, or the FDA did, we can say that, for instance, for EMA, distance assessments were used to some extent over the pandemic, so especially in 21 and 22. An additional measure for the EMA to focus on the most critical on-site inspections and to postpone the need for the routine monitoring ones was to extend the validity of the GMP certificates till the end of 23, so that EMA was able to focus, speaking about the on-site inspections, was able to focus only on the most critical ones. And the same did FDA. So for FDA, the impact of pandemic was even more significant, with more than 50% reduction over the pandemic period. So FDA decided to prioritize the domestic inspections or those considered as mission critical.
Right. Okay. Now let's look ahead though. So what is the expected trend of GMP inspections in 2023 and beyond?
I can say that I can summarize the upcoming future with two main concepts. One is the international collaborations, and the second one is risk-based and hybrid approach. Right. So speaking about international collaborations, I can say that already in the recent past, or over the past 10 years, the willingness to rely on results produced by foreign national competent authorities had increased. So for instance, EMA has in place mutual recognition agreements with other authorities that can leverage on the concept of collaboration between agencies. Right. So European Medicine Agency has several agreements in place with other countries, including US FDA. Also, as part of new initiatives, there is an additional EMA objective to expand the scope of the mutual recognition agreement in place with the US FDA to include other products like animal health medicines, vaccines, and plasma derivatives products. From a risk-based and hybrid approach standpoint, the agencies will continue to prioritize inspections based on factors like the nature and number of products in scope and the compliance history of the site. So not only the regulatory compliance, but also an history including complaints, recalls, and other significant quality events. Right.
Okay. And final question, what lessons from the pandemic do you think companies should take with regards to inspection readiness?
Well, the hybrid inspections might become a real tool for the future. So I think that both the regulatory authorities and the companies will move from a real necessity just during the pandemic to a more conscious and disciplined choice in the future. So even if remote inspections will never replace routine on-site GMP inspections, they have allowed many authorities to continue their surveillance programs during the pandemic when the only alternate option was to stop everything. So authorities have expressed their interest in continuing the integration of their inspections with remote or hybrid solutions. For companies, the remote inspections, it is true that they are tighter and require concentration-intensive days, but they also present many advantages for those companies. So for instance, sharing all documentation with the inspector by video conferencing system, or providing the inspectors with the temporary access credentials to their platforms is an important evidence signal of the level of trust. And also, there is a consideration about saving time and costs, because the new remote approach decreases travel time and travel expenses and carbon footprint markers by reducing travel of person. I think that a concept that should be introduced by in companies is inspection readiness programs. So right. Inspection readiness should really become a paradigm and should consider, for instance, that all documents should be digitized so that they can be easily made available to inspectors. Regulatory agencies also will put more emphasis on, we have already discussed about risk-based determinations for inspections. So regulatory agencies may perform heavier due diligences upfront of on-site, remote heavier due diligence upfront of on-site inspections. So this is really going to push companies to achieve a permanent inspection readiness state.
Yeah, and I suppose based on that, they have to, like you said, be more paperless in terms of their audit trail and make sure they have it all documentation digitalized to make that possible. Right. Brilliant. Well, look, Davide, thank you very much for giving me that quick overview of what's been happening with GMP inspections. If people want to know more information, where can they get more information?
About PQE, they can reach our website, and they can follow us also on our social
LinkedIn.
platforms.
Yeah, sure.
We have a wonderful marketing department, wonderful communication department, so we can be available also on all the most important social medias.
Fantastic. And obviously, if anyone's got any questions based on what you've said today, they can get in touch with you directly via LinkedIn, correct?
Sure. Also, yes.
Fantastic. Well, there you go, viewers. I hope you found that interesting. I generally did learning more about GMP inspections and the future trends within that space. Obviously, it's a very, very important topic. So if you'd like to know more from Davide, you've got any questions for him, then feel free to put them in the comments below. I'm sure he'll be only too happy to answer them. And obviously, I will put the link to PQE above the video as well, so you can click on that to learn more information there as well. So Davide, thank you very much for your time today. It's lovely to meet you. I know you've been very busy traveling as well, so I appreciate taking time out to talk to me this afternoon. And viewers, thank you for watching. And until next time, as always, stay well and stay safe. Bye-bye.
Thank you. So.